Hello, my name is Samantha Montalegre and welcome to The Maternity Mentor. Today we're going to be talking about caffeine and alcohol use during pregnancy and breastfeeding. Thanks for joining us. For anyone who doesn't know me, I have been a registered nurse since 2009. I've spent my entire career working in the maternal newborn nursing area, including mother-baby postpartum, NICU, antepartum, and labor and delivery. I have practiced as an IBCLC since 2012 and have been maternal newborn nursing certified since 2013. I have also received specialized training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Caffeine is one of the most beloved stimulants used all over the world. Alcoholic beverages are also enjoyed throughout many cultures. When women become pregnant or plan to breastfeed, they often wonder whether they can continue to enjoy these beverages. This video will explore the recommendations on the usage of caffeine and alcohol during pregnancy and breastfeeding. Let's start with caffeine. Caffeine is a chemical found in many beverages that can give you energy, which is why it is so popular. Caffeine is a stimulant, which means it stimulates your body, causing an increase in blood pressure and an increase in heart rate, neither of which is recommended during pregnancy. Caffeine is also a diuretic, which means it causes you to urinate more often. This can lead to dehydration if the fluids are not replaced. Caffeine affects the nervous system and can lead to symptoms of irritability, nervousness, restlessness, and sleeplessness. It's extremely important to know your sources of caffeine, or you could inadvertently consume more than you intend to. Caffeine is found in coffees, teas, sodas, chocolate, and some over-the-counter and prescription headache medications. It's even found in coffee-flavored products like yogurt and ice cream. Energy drinks also contain caffeine. However, they are not recommended because the other ingredients are unsafe during pregnancy and breastfeeding. It should be noted that decaf coffee and cold remedies can also contain caffeine, so you need to make sure you read the labels. When calculating caffeine intake, make sure you know your serving size. Additionally, just because a brand of coffee is 70 milligrams of caffeine per serving doesn't mean they all are. Again, make sure you read the labels. The first thing to understand about caffeine is that it crosses the placenta. This means that the baby also receives doses of caffeine and feels many of the same effects you do. It acts as a stimulant in the baby, which can be difficult for the baby to handle since your baby's metabolism is still developing. It can also change the baby's sleep and movement patterns. Additionally, pregnancy affects a woman's caffeine metabolism, slowing it down, which causes the caffeine to stay in the system longer, exacerbating all potential side effects. Some studies have indicated that consuming high amounts of caffeine can cause infertility or delayed conception. However, research is ongoing on this subject. Caffeine has been shown to cause birth defects, preterm labor, and premature birth in animal studies. However, human studies have been inconclusive. Finally, many women are told caffeine can cause a miscarriage. A study released in the American Journal of Obstetrics and Gynecology showed women who consumed 200 milligrams or more of caffeine per day were twice as likely to have a miscarriage. However, another study in epidemiology showed no additional risk with minimal consumption of caffeine, which was defined as 200 to 350 milligrams per day. The March of Dimes reviewed the data and have recommended that women consume no more than 200 milligrams of caffeine per day until additional studies have been conducted. The American College of Obstetricians and Gynecologists, also called ACOG, also recommend 200 milligrams of caffeine for any woman who is pregnant or planning to become pregnant. For perspective, 200 milligrams of caffeine equals one 12-ounce cup of coffee. The safest bet is to avoid caffeine as much as possible during your pregnancy. You can speak with your healthcare provider about the safest sources of caffeine and how much they recommend you intake if needed. Many women are concerned about caffeine intake after they give birth because they are breastfeeding. Caffeine is awesome because it can give a sleep-deprived mom energy and focus to take care of her newborn. However, caffeine is transmitted through the breast milk, so your baby will get small doses of caffeine when breastfeeding. About 1% of the caffeine you consume will enter the breast milk, and it peaks in concentration 1 to 2 hours after you drink it. This is a relatively small amount, but newborns take longer to process this due to immature livers and kidneys. Additionally, babies can retain caffeine in their system for 65 to 130 hours. The caffeine can also continue to accumulate in their systems as more caffeine is consumed by mom. This can lead to a baby that is more restless and irritable and has trouble sleeping. But sometimes you need that pick-me-up. The American Academy of Pediatrics has stated that caffeine is compatible with breastfeeding, citing that caffeine is used as a medical treatment for premature babies to assist with breathing. Having caffeine during breastfeeding is considered safe and should be limited to 300 milligrams per day. That is the approximate equivalent to 2 to 3 cups of coffee per day. If you are able to avoid caffeine during your pregnancy, try to continue to avoid caffeine while breastfeeding. It's better for you, and some research shows that babies who were not exposed in utero to caffeine are more sensitive to it when received through breastfeeding. Many mothers ask whether caffeine can affect their milk supply. The research shows that it does not directly affect milk supply. However, if caffeine causes the baby to be more irritable and the baby starts eating less, this could impact your milk supply. The bottom line is if you can avoid caffeine, avoid it. But if a cup of coffee keeps you sane, especially after a long night with your baby, don't feel guilty and enjoy your coffee. Now let's talk about the use of alcohol during your pregnancy. All types of alcohol are equally harmful, including wine and beer. There should be no use of alcohol during your pregnancy. Alcohol use during your pregnancy can cause miscarriage as well as stillbirth. Additionally, alcohol easily passes through the umbilical cord directly to the baby. This can cause fetal alcohol spectrum disorders, which can lead to many lifelong disabilities, including abnormal facial features, small head size, shorter than average height, low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and suckling problems as a baby, vision or hearing problems, problems with the heart, kidneys, or bones. If you are currently drinking and you become pregnant, please stop drinking immediately. If you need assistance with quitting, contact your healthcare provider for resources to quit drinking. You can also reach out to your local Alcoholic Anonymous group for resources. When breastfeeding, the safest bet is to avoid alcohol. However, there are ways to enjoy your favorite cocktail and still breastfeed your baby. Alcohol does pass into the breast milk and reaches its highest concentrations 30 to 60 minutes after your consumption of it. The more alcohol you drink, the longer it stays in your system and your breast milk. Most experts agree that moderate alcohol consumption is not harmful to the baby if the mother waits 2 hours after consumption before breastfeeding her baby. Moderate consumption is consuming up to 1 standard drink per day. It should be noted that you need to know your standard serving sizes and measure accordingly. For example, you can't just pour wine into a glass and call it a day. The standard serving size for wine is 5 ounces and it should be measured accurately. Many people believe drinking alcohol can increase milk supply and assist with letdown. Both are incorrect assumptions. Alcohol has been shown to interfere with the hormones related to making milk, prolactin and oxytocin. This can lead to a decrease in your milk supply. Further research has shown that while babies may eat more frequently after alcohol consumption, they actually eat less volume or remove less milk from the breast, which can decrease your milk supply. As for increasing milk supply, it used to be that some of the grains and herbs used for making alcohol, especially beers, did help boost supply. However, nowadays ingredients are cheaper and do not support the increase of breast milk production, and therefore drinking should not be used for this purpose. Anything more than moderate consumption will not only interfere with the milk ejection reflex, but it can also have serious impacts on your baby's health. The baby can have interrupted sleep-wake patterns, decreased growth and weight gain, as well as reports of developmental delays. The baby's safety is also at risk because of the mother's impairment. Excessive drinking can cause excess fatigue, impaired coordination, and poor judgment in the mother. It is imperative, if you have been drinking, that your baby is placed back to sleep in a safe area like a crib and not in your bed, as there is an increased risk of SIDS or suffocation. Make sure you arrange for sober childcare if you are planning on drinking excessively, because caring for your baby while intoxicated is not safe. Now let's talk about pumping and dumping. Pumping after drinking does not remove alcohol from your system or your breast milk faster and will not help you sober up. Alcohol enters the breast milk because the bloodstream is saturated with alcohol. As alcohol leaves the bloodstream, alcohol from your breast milk re-enters the bloodstream until all the alcohol has been processed and is no longer in your milk or system. Drinking water and coffee or resting will also not speed up the alcohol from leaving your body. Now, if you're going to be away from your baby for an extended period of time, let's say your best friend's wedding, or you're planning on drinking excessively, you may want to pump and dump. First, your milk during this time will contain alcohol due to your blood alcohol levels. Second, you should be pumping as often as your baby would have been eating in order to maintain your milk supply. Also, pumping regularly when not feeding your baby can reduce your chances of developing mastitis or plugged ducts. In the end, if you are trying to decide how much is too much alcohol, if you are sober enough to drive, you are probably sober enough to breastfeed. Drinking the occasional alcoholic beverage should not be discouraged just because you are breastfeeding, as this can lead to feeling restricted and may affect your decision to continue to breastfeed. Instead, try not to drink alcohol until your baby is 3 months old, and then practice moderation. If you have additional questions regarding the use of alcohol in breastfeeding, contact your healthcare provider or your baby's pediatrician. Pregnancy and breastfeeding do not mean the end of your coffee drinking days, and while you need to abstain from alcohol while pregnant, breastfeeding does not stop you from having the occasional drink. Moderation is key. We hope this video has taught you the safe way to drink alcohol and caffeine to ensure you have a healthy baby and a healthy pregnancy. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family, and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.